Which former child star has had the most plastic surgery? Let's find out. And if you haven't already, please make sure to subscribe to this channel. And when you get a chance, head to feelconfident.com to check out our products. We're gonna do a facial analysis and a reveal of certain plastic surgeries that Ariana Grande may have had. So 2009, so Ariana is 16 at this point. And what I wanna highlight here are her sort of beautiful features of youth, right? And then we'll see how things may have changed over time. Obviously, this was before any kind of surgery. I just want to point out a few things here. So one is that if you look at her eyebrows, the tail of the brow and the head of the brow, so the lateral aspect and the medial aspect, are on the same horizontal plane. And that's a very youthful thing, and that's something that we look for when deciding whether or not to do a surgery. The lateral canthus of the eye, which is the outer corner of the eye, lives slightly higher than the medial corner of the eye. Not much higher, but slightly higher. It's another youthful feature. And actually there's a functional aspect to it, which is that when tears are made in the eye, you want them to flow towards the nose. And so that's partly the reason for that cant of the eye that we have in youth. If you look at her nose, she has a very natural shape to it. There's a slight bulbosity to the nose tip, but it's a very soft, natural nose. There's a heart-shaped aspect to her face. The lips have very natural proportions where the lower lip is actually larger than the upper lip, which these days that aesthetic principle has kind of been distorted a little bit, but in classic beauty and just the way that most of us are born, that is a very natural feature of the bottom lip being slightly bigger than the top lip. Again, it's different across different individuals, genders, ethnicities, but at least for her, that's a very natural look. Also look at the contour of the jawline. Just keep in mind that contour compared to what we see a little bit later. So 2010, age 17, looks about the same. Not much has changed. 2011, age 18, again, fairly unchanged, has some different kind of makeup on, whatever, but a very normal 18-year-old girl without any plastic surgery that I can see. 2012, age 19, again, doesn't look like she's had any work done. 2013, at the age of 20, I'm starting to see some changes. I think that she's had her first rhinoplasty at this point. If you look at Ariana's nose here, the bridge is narrower, the tip is less bulbous, the tip is slightly raised, and there's a bit more nostril exposure, which is another giveaway for a rhinoplasty. Doesn't mean it's a bad thing, it just means that that's oftentimes what happens when you adjust the tip cartilages. You get a little bit more nostril exposure, and so that's what we're seeing here. 2014, age 21, the angle of the mandible, which is this area here, it's called the gonial angle, it appears more defined to my eye. So possibly this is the result of filler, or maybe even at this point an implant into that area. And a lot of people online will talk about a chin implant that she may have had, even though she already has a prominent chin, but just to kind of equalize the sides here, the wings of the chin. I think possibly there's been an extended implant that has also improved the gonial angle. Also, at this young age, 21, I'm seeing signs of a brow lift, most likely performed endoscopically inside the hairline. One of the giveaways here is the positioning of the eyebrow. The left one looks like it was lifted more than the right? So there's this asymmetry, the left higher than the right, and you'll see that play out for a number of years until some of the more recent photos that we have of, I think, just within the last year, where she likely got that corrected, as you'll see. Keep watching. 2015, age 22, it looks to me like Ariana may have had a canthoplasty, because the tilt of her lateral canthus is even more elevated, despite the makeup that she has, but it's even more elevated than what I was seeing prior, and that's kind of turned her eye shape into something a little bit more almond shaped that some people like. So that looks to me like it was likely done at around that time. 2016, age 23, it looks to me like the lips have been filled with some filler, likely a hyaluronic acid based filler. Now the upper to lower lip proportions are closer to a 1-to-1 ratio, and it looks like she's had some cheek filler as well. Age 24, I'm seeing a pretty stable image, not too much has changed. 2018, age 25, also about a stable type of image. 2019, age 26, Ariana, I think, has gotten even more lip filler. So now there's probably some of the filler from before, and she's added to that with an additional syringe or more of HA filler. So you're seeing that here. You know, I was wondering about that tooth show that I'm seeing, and maybe if she had a lip lift. I looked back at some of her original photos when she was younger, and when she opened up her mouth on a pose that we call repose, actually, like this, I could also see tooth show, and the shape of her teeth, especially those central incisors, I think is pretty stable from when she was younger. So I do not think that she's had a lip lift, by the way, in case you were wondering. 2020, age 27. I think you can really see the outline because she's so thin, right? So you can really see the outline of that jawline implant. And I think it's an extended type of implant that's not just augmenting the sides of the chin, but also stretching on to this angle as well. That's what I'm seeing, at least in these pictures. It's a very, very clean jawline, but it looks to me like there's some surgical work that's been done there. Now in 2021, at the age of 28, this is just this year, I think that she's had a revision rhinoplasty. So the tip of the nose looks even more refined than it did after her first rhinoplasty. And now there's an even more obvious, what we call a supra-tip break. And that's that area right over the tip of the nose. And we have a whole rhinoplasty modeling video that talks about that in more detail. Make sure to check that one out. So the supra-tip break, right, then goes into the bridge. And it looks like that division has been more refined with this second rhinoplasty surgery. It looks like she likely had a revision brow lift because now the brow height is a lot more symmetrical, and she may have combined this brow lift with a ponytail facelift. It's possible because if you look at the nasolabial folds, they look more effaced, and you can do that with filler, but it starts to take on a unnatural type of appearance over time, especially if you're doing large quantities of nasolabial fold filler. So I think just based on the tightness of her face and the way that it looks stretched back, and again the shape of the eye and the brow repositioning, I think she may have had a ponytail facelift, which is a very young age to get something like that. So again, I could be wrong, but that's just an educated guess. We don't know for sure, of course. So I wanted to then kind of give you guys just like a general warning. And I know for Ariana it's different maybe because she's, you know, this huge international pop star and has a huge, you know, following. So maybe different, and she needs it for her job, or at least she feels like she might need all this stuff for her job. I would hope that she wouldn't need it for her job, but you know, that could be some of the pressures that some of these top stars are under. But just like a warning in general about getting plastic surgery at a very young age and starting that early, especially when you're doing a lot of different aging face type of surgeries. When you start at a very early age, first of all, the expenses add up, right? Because with no surgery is perfect, so you might have, like what she had after the first brow lift, some asymmetry, right? So now you're getting another surgery to correct that symmetry. It kind of goes on, right? And then if at age 28 you're used to a pretty tight appearance, you might notice that 3 years later there's going to be a drop. So now you're going back in, doing more surgery. Over time, even by the time you reach like, still a fairly young age, like 50, you will have had so many plastic surgeries that, you know, can build up scar tissue and have some ramifications that aren't always so positive. So just a warning to put out there to young folks who are seeing this video or seeing just all the different plastic surgery content thrown at them and considering doing this stuff. Just have to be super careful and know what you're getting yourself into, and be careful with like doing a ton of combination procedures that really will add up over time and could have some ill effects over years that you don't even anticipate now. Back to Ariana Grande, a summary now of all the different surgeries that I think she may have had up to this point, right? She's only 28. And I'm gonna give you prices here, rough estimates. Rhinoplasty, about $10,000 to $20,000, this is the range. Revision rhinoplasty, $15,000 to $40,000. Jaw, cheek, lip filler with some maintenance, right? Figure $10,000 a year for
over the course of about 7 years. Jaw implant, if she had that, 10 to 20,000. Brow lift, 10 to 20,000. Brow lift revision, 15 to 30,000. Canthoplasty, 10 to 15,000. Ponytail endoscopic facelift, $30,000 to $80,000. If you add that all up, at the higher end of those ranges, you're looking at about $295,000. $295,000 to look as exceptional as Ariana Grande. It's not for most people.
Over the years, we witnessed Zac Efron's journey from teenage heartthrob to the leading man that he is today. But has Zac undergone plastic surgery to achieve his stunning facial features? Or are these changes simply the result of natural aging and lifestyle choices? The total cost of the potential procedures will be mentioned towards the end of the video. In 2004, at the age of 17, Zac has a boyish hairstyle. You can barely even see his forehead. He also has thick eyebrows with some arching. This is a bit more arching than you'd see in a typical male eyebrow, but you'll see the correction that occurs later on in this video. He also has prominent orbicularis oculi muscles, and you can see that right at the lower eyelid. It's not that he has fat bags that are prominent in the lower eyelids at 17, rather he has a prominent muscle that makes it look like there's an eye bag. Zac also has a thin and relatively flat upper lip. If you follow his upper vermilion lip, you'll see that laterally it's quite inverted. He also has a central incisor gap and a strong chin. In 2005, at the age of 18, what I'm seeing here is that Zac has a relatively flat nasal bridge. He also has mild tip bulbosity and mild alar flaring. When you look at the width of his nasal base, you can see that it's not quite aligned with the medial canthi of the eyes. Instead, the nasal base appears slightly wider than that distance between the eyes. In 2006, at the age of 19, now what I'm seeing is that there is a closure of the gap between the central incisors. So maybe this is the result of braces that he had or potentially veneers that were placed. In 2007, at the age of 20, I'm seeing the results of a potential rhinoplasty surgery. The tip bulbosity has been reduced. It's not quite as round and as wide. There's also a slight increase in infra-tip prominence. That's the area at the base of the nasal tip. Sometimes we discuss the supratip, and that's the area right at the top of the tip as it gets into the dorsum of the nose. And other times, it's the infratip that's relevant. And in this case, it looks to me like there's a little bit more prominence in that infratip area. Also, I think that Zac's nasal bridge may have been narrowed, and that's usually done by adjusting the nasal bones through osteotomies. In 2010, at the age of 23, referencing what I said prior, you can see that Zac now has eyebrows that appear more horizontal. And this simple grooming change now leads to a more masculine appearing face. He also has reduced infrabrow space, which gives him a more mature look. In 2012, at the age of 25, Zac has a youthful hairline, but he's entering the age of when we start to see accelerated hair loss. And that's usually in our mid-20s, late 20s, into our early 30s. And for most men, that's the time when we lose more of our hair. So in order to protect the hair, that's when we start to get into discussions of finasteride to reduce the levels of DHT that cause the miniaturization of our hair, and sometimes also minoxidil to help stimulate the growth of our hair. So for those medications, we always recommend you go to feelconfident.com for more information. My guess is that Zac may have explored these medications around this time. In 2014, at the age of 27, what I see here is potentially the result of another rhinoplasty procedure. It looks to me like the tip has been further narrowed. When you look at the way that the light hits the tip of the nose, you can see the light reflex off of the tip. There's two spots there, and that to me is more narrow than it was prior. And as you follow the dorsum of the nose from the top down to the tip, you'll see that the width looks about equal, whereas in the past it used to come down and get wider as you got to the tip. That to me suggests a gentle refinement, that has changed his look. In 2020, at the age of 33, mostly what I'm seeing are weight gain changes. You can see the result of that weight gain in his facial features. One way to tell that it's more related to a weight change rather than actual procedures is to, of course, look at the rest of the body, but also to see that the weight increase is now diffusely throughout the face. It's not just one area that's been enhanced, but rather from the temples down into the cheeks, into the lower face. You can just see that there's more volume there. But in 2021, at the age of 34, this is when we're seeing more significant changes to his face. The cheeks, the jawline, all look more refined. His chin, for example, protrudes further than it did in the past. Compare this back to 2011 in a profile view, and you'll see that now that chin has more extension forward than it did previously. There's also increased width to his gonial angle. So if you look at the lower mandible from one side to the other, you'll see that there's increased width right here. And if you follow the temples down and you look at the contour, look how it starts to slope outwards. And this is similar to what I discussed in my Cristiano Ronaldo facial analysis. So what may have happened to cause this change? According to Zac, he fell at home, hurt his chin, and then during recovery, his masseters got enlarged and grew more than they did in the past. Now, is that possible? Maybe, but I've dealt with treating a lot of facial trauma in the past, and I never saw that type of impact on the masseter muscle, specifically from a chin injury. So have I ever seen that in my clinical practice? No. Is it possible? Maybe. As they say, hey, you never know. Other possible explanations are the following. One is that maybe he did have a fat transfer procedure, and I did a short on exactly this topic on Zac Efron around the time that this was happening, and in that video I speculated that potentially it was the result of a fat transfer. But now I think differently. I think odds are that he may have had a custom 3D printed jaw implant along with cheek implants. For me, I'm seeing too much change to just attribute it to a specific chin trauma, and I'm seeing bony changes that I think go beyond the effects of what a fat transfer can do. And because of how regular and symmetrical the increased volume is, I think it's more likely implants rather than a filler type material. I also see some signs of added lip filler. In 2022, at the age of 35, it's possible that Zac may have had some jawline filler. There is now a smoother transition from his chin to the body of the mandible. It's also possible, though, that he may have had a revision of that lower jaw implant. When you look at the gonial angles, they do appear less wide. So could this be a revision of his prior implants? Maybe, but it could also be that some areas got smoothed out with the application of filler. The total cost of these potential facial plastic surgeries is $100,000. It's Dr. Gary. I'm a hair transplant surgeon, and I wanted to talk about Justin Bieber. He is an amazing musician, and I play his music in the operating room all the time. We're going to be talking about Justin's hair loss. We're going to be talking about androgenic alopecia, traction alopecia, and what men ought to do when they're in a situation like Justin and starting to see the early signs of hair loss. In 2012, at the age of 18, Justin has a very youthful hair appearance. He's also combing it down, so he has even more coverage, and it just looks like a great head of hair. 2013, at age 19, also you can see just a very, very youthful Norwood 1 type of appearance with very high density at the hairline. The temples are well outlined. He has all this like baby hair, fine hair up front. I mean, it just is very youthful, very framing to his face. 2014, age 20, also similar appearance, not much has changed at this point. 2015, age 21. You can sort of make out there's very early frontotemporal reduction of density, but it's still looking extremely youthful. Age 22 and 2016 also a similar appearance. At age 23 in 2017, I'm seeing the first signs of frontotemporal hair loss, and he's inching towards a Norwood 2, and this appears to me to be an androgenic alopecia type of situation, which is the most common type of hair loss in men, and this is a very common pattern that we see. It typically will start with the frontotemporal areas starting to recede back, starting to thin out, and the entire hairline slowly starting to come up, so you have more forehead showing. Those are the early signs of androgenic alopecia, and that's what we're starting to see with Justin Bieber in 2017. In 2018, at the age of 24, Justin Bieber now has a more defined Norwood 2 type of hair loss pattern. He has more frontotemporal recession. You can see an M-shaped pattern to his hairline. Age 25 in 2019, he has a very similar pattern. Age 26 in 2020, again, something very similar. But in May of 2021, he changed his hairstyle. He changed it to dreadlocks. And so I wanted to take this moment to talk about traction alopecia. This is a type of hair loss that occurs when you put the hair on stretch. You are then causing inflammation to occur at the root, at the follicle of that hair shaft. And when you have this type of inflammation, it can eventually lead to hair loss. So he has to be very careful because he already has those signs of androgenic alopecia that we talked about before. And on top of that, he's adding the insult of traction alopecia, and potentially that can lead to a more accelerated type of hair loss with his condition or his situation. So then in May of 2021, he decides to get rid of the dreadlocks. And this is really interesting here because what I'm seeing when I zoom in on this photo of him just laying here on this couch type thing is that it looks like he's got some concealer going on right at the corners. In the walking image that you see here, the corner looks exposed to me, and it doesn't look like there's any concealer there. Whereas in the image of him that he posted on Instagram, I'm seeing a more filled in corner, and when I really zoom in, it doesn't look like there's hair at that corner. It looks like it's some form of a concealer to improve the corner. So now what should Justin do? Aside from trying to avoid those tight hairstyles that we talked about, he has a few options. One is he could do nothing. He can just accept the fact that he's starting to lose some hair and really not do a whole lot about it. That's a reasonable option. Another option is that he can shave his head, and some people choose to go down that route. I think that would be somewhat extreme given that he has very, very early signs of hair loss. He can also choose to wear a hairpiece, which some people in Hollywood do, but again would be a bit extreme for his type of hair loss and not something that I think he would do for many, many years if he even wanted to go down that route. Lastly, he can go down the route of hair restoration. And with hair restoration, it kind of breaks down into two main types of approaches, right? You have a medical therapy approach and you have a surgical type of approach. And there are a few things in between. There are two primary hair restoration goals. One is to stabilize the hair loss and to enrich the existing hair follicles. And two is to consider augmentation options with, say, concealer, scalp micropigmentation, or even a possible hair transplant. These are not mutually exclusive goals, and they can be combined to deliver the best possible outcome. So let's talk about stabilizing the hair and promoting regrowth of the hair. There is the tried and true method, which is the first line of hair restoration for medical therapy, and that includes Propecia, or the generic form, which is finasteride, and minoxidil, which is sometimes known as Rogaine. Rogaine is the topical, but minoxidil comes as a topical or an oral formulation, as you guys know from our minoxidil video. The second line treatments would be something like microneedling. It would be PRP, which is platelet-rich plasma, laser caps, and biotin-based vitamins. That would be second line, but the first line is what I always tell people. It's going to be the Propecia and the minoxidil. Some people choose not to take some of these medications because of side effect profiles, and I respect that. And then we'll go into the second line of treatments when that's the situation. As far as augmentation goes, There's a concealer option. These are keratin fibers that have different colors to them. They're actual keratin proteins that are colored, and they can blend undetectably with existing hair. And you can kind of instantly create the appearance of a more natural type of thicker, fuller hair. Another augmentation option for the hair is scalp micropigmentation, or sometimes known as SMP. This uses ink to temporarily mark the skin, so it's almost like a temporary type of tattoo. It doesn't go as deep as a tattoo does, and it gives the illusion of some hair. It is two-dimensional, so it doesn't look as realistic as actual hair. It also will reduce, hopefully, the scalp shine through that some people have. It also slowly fades over time. It may not completely go away. That's something to keep in mind. And the color might change over time. There are multiple sessions that are usually done for scalp micropigmentation. And then we have, of course, the hair transplant augmentation option. There are different types of hair transplants, as we talk about on this channel. It's important to budget the hair that you have. There is a finite donor supply of hair that we all have on the back of the scalp, side of the scalp, and then of course there are some other donor sites like the neck, like the chest and the back, but they're never going to be as great as scalp hair, as we talk about in other videos of ours. And so it's all about trying to figure out how much hair is needed at the recipient area and how much hair you have at the donor area. It's that equation that we're constantly juggling. And there are two basic types of extraction methods, FUE and FUT, and we've done videos talking about each type and the pros and cons. For Justin Bieber, what would I do if he came to the office and said, I'm looking for a hair transplant at this stage? I would make sure, first of all, that he's on medical therapy to reduce the progression of his hair loss. That's very important. And I would offer him a procedure that would be on the conservative end, because he doesn't have a ton of recession, and he overall has pretty good hair fullness in the mid-scalp and crown. So I would go with a procedure of about 1,200 to 1,400 FUE grafts to the frontotemporal areas and to the temples to bring them forward and reduce that scalloping appearance of the temples, and to just better reframe his face. And we would do a donor shave approach where, since he's already used to short hairstyles, I would just shave the back to allow us to then get the grafts. I do prefer shaving the back of the head compared to doing a no shave technique, because I feel like my distribution of the FUE harvest is a bit more balanced and properly distributed, and I think that's important. So that's the way that I would approach Justin Bieber's hair if he wanted to go down the hair transplant route. But of course, he doesn't need a transplant. No one needs a transplant. It might just be something that he one day decides on, like many other celebrities have.
Well, here's a fun fact that you may not have known. Lindsay Lohan and I actually grew up in the same town, Merrick, New York. And many of you have messaged me recently asking for my thoughts on Lindsay's recent transformation. Well, I think it was more than just our Feel Confident moisturizer that created these changes. Well, hang around to find out what I think she may have had done and how much it could have cost her. In 2002, at the age of 16, what I'm seeing here is that her right hairline is higher than her left. This is also where her natural part line is. Keep in mind that a natural part line is where the direction of the hair changes. So on her right side, it looks like the hair is changing direction. She also has youthful infrabrow fullness. That's that fat pad that exists right underneath her eyebrows. Her lateral canthus sits higher than her medial canthus, and that's a youthful trait, partly because that's the way that our tears flow. The lacrimal gland lives up here, and that's where the tears are created, and then they travel from the lateral portion of the eye down towards the medial portion of the eye, and then down through the lacrimal duct, and then the lacrimal duct ends inside the nose. And that's why when we get teary-eyed, our nose also starts to feel stuffy. Lindsay also has a well-defined supratarsal crease at the upper eyelid. I know I often say that people have a bulbous nose, but in Lindsay's case, she really has no obvious tip bulbosity, and that speaks to the shape of her lower lateral cartilages. edges. They're flatter in configuration than in most people, where they tend to be more curved. She also has prominent medial cheek volume and a strong mandible, which is the lower jaw. In 2003, at the age of 17, I'm noticing that Lindsay's eyebrows sit relatively high and she has natural arching. Notice that her medial brow is on the same horizontal axis as the tail of the brow. This is quite natural and youthful. And this is one of the issues with the cat eye look, where people are overlifting the lateral portion of the eyebrow and the tail ends much higher than the medial aspect, and that looks not as natural. Notice that Lindsay's nose is well proportioned to the rest of her face, and she has full upper tooth show on smile. She also has a relatively short philtrum, and her bottom lip appears to be fuller than her upper lip, which is also a very natural feature. In 2004, at the age of 18, I'm noticing that Lindsay's upper horizontal third is longer than her middle third and her lower third. She also is right side dominant, meaning that the underlying bone of the right side of the face is a bit larger than the left side, and that I think also in part explains the higher hairline on the right compared to the left. We see a right side dominance in the majority of people, and we also see that the right side of the hairline recedes more than the left in both men and women the majority of the time. In 2005, at the age of 19, it looks like Lindsay has been going through lots of different hair color changes. And while this might be good for various movie roles, it can potentially be a problem when it comes to proper hair integrity. It could have a negative impact on the quality of her hair. Remember that many hair dyes have various chemicals like ammonia and peroxide that can be damaging to our hair. It looks like Lindsay may have also started getting some lip filler around this time. I'm noticing some added anterior projection of her upper lip in particular, and some of the filler seems to be settling out just above the vermilion border. In 2006, at the age of 20, I see no change. In 2007, at the age of 21, I wanted to point out here that Lindsay has nice upper tooth show on repose, meaning when she just parts her lips like so. And this is a big reason why people come to me for a lip lift, because they want more upper tooth show. They want more of what Lindsay has naturally. But remember that upper tooth show is not always guaranteed with a lip lift. We don't want to chase achieving the upper tooth show and then have too short of a philtrum that just doesn't look proportional to the rest of our face. And also, as we lift more and more, there's more arching that develops with the upper lip. So sometimes it's not worth taking off more skin just to arrive at some upper tooth show. But many patients do attain more upper tooth show, at least in a dynamic smile type of configuration. And for many of my patients, they get it at a more static repose position as well when they just part their lips. So usually it comes down to underlying anatomy for whether or not we can attain upper tooth show with a lip lift. In 2008, at the age of 22, I see no change, and that's the same through 2010. In 2011, at the age of 25, I'm seeing some rhytids or wrinkles developing on Lindsay's forehead. And this is what usually happens for most people as we reach our mid to late 20s. Also, I'm noticing that Lindsay's upper lip is getting heavier from the potential filler that she was getting around this time. And it looks like it's settling into the cutaneous lip above the vermilion border. And that is what can happen with lip filler. Even when it's injected into the body of the lip, it can still migrate up into the cutaneous lip. And oftentimes lip filler is actually placed into the vermilion border to try to recreate the roll that naturally exists there. But as you do that, that filler can often spill over and expand and migrate into the neighboring tissues and into this cutaneous portion of the lip where it starts to look less natural. In 2012, at the age of 26, it looks like Lindsay may have gotten some veneers around this time, and as we know, this is a very common procedure for people to get in Hollywood, and outside of Hollywood too. But to me, the coloration and the shape of her teeth just look different compared to prior years. In 2013, at the age of 27, I see no change. And in 2014, at the age of 28, I'm noticing that Lindsay's forehead wrinkles are getting a bit deeper. You can see them more at rest, and when she animates, those wrinkles are now a bit deeper and starting to get slightly etched in as well. In 2015, at the age of 29, I see no change, and that's the same through 2017. In 2018, at the age of 32, it looks like Lindsay's forehead, her glabellar region, and the crow's feet appear smoother, so I wonder if she started to get Botox or some other neurotoxin around this time. The 30s is a popular decade these days to get Botox, and some people are even starting in their 20s for prejuvenation. And if you do that at an earlier age, you have to be careful because the muscle can atrophy, and you can, for example, lower your eyebrows more permanently if you start to paralyze the forehead muscle too often and at too high of a dose. In 2019, at the age of 33, I'm seeing some increased use of lip filler. You can tell that the upper lip is looking like it has a similar amount of volume now compared to the bottom lip, and that was very different from how she looked prior. I'm also seeing the potential introduction of some cheek filler as well. She has that medial cheek volume that she's always had, but also now it looks like there's a bit more settling into the lateral cheek, so I wonder if that was enhanced with some cheek filler. Remember that the filler that's used for the lips is different from filler that's used for the cheeks. For cheeks, we usually use a higher G' filler that's thicker and that's usually placed closer to the bone, whereas the lips are a more delicate structure and require a lower G' type of filler that is softer and that can work better in the more mobile lip structure. In 2022, at the age of 36, Lindsay is now back on the scene with what looks to be fuller eyebrows. To me, it looks like it was likely microblading that created these changes, because I can see a slight color difference from her natural eyebrows to where the microblading was likely done. I think an eyebrow hair transplant is much less likely, because usually the hair that's taken from the back of the head, even if it's single hair grafts, tends to be more coarse than our original hairs at the eyebrow. And I just don't see that effect in Lindsay's case. Usually for eyebrow hair transplants, we place the transplanted hair throughout the eyebrow, even if there's a section that appears more naturally full, so that there's more of a homogeneity of the eyebrow itself, and usually the coloration looks fairly consistent. But when you have microblading in place, you can typically see a color mismatch between the original hairs and the ink that the microblading leaves. Also, it looks like Lindsay may have had an upper blepharoplasty, because when I look at our upper eyelid, there's more supratarsal show. That platform of the upper eyelid just appears to be more visible compared to prior, and that's something that we can see with a blepharoplasty when some of the excess skin is removed. And the upper blepharoplasty scar is typically hidden into that crease as well. I am also seeing some signs of a potential rhinoplasty sometime between 2019 and 2022. It looks like the bridge of her nose and the tip of her nose are now even more narrow than they were before. And like I said previously, I don't think Lindsay ever had a bulbous type of nose. She always had a fairly petite nose, and now it looks like it's just been narrowed more, and it has that kind of streamlined appearance from the bridge all the way down to the tip, and that degree of definition I don't think she had previously. Anytime we narrow the nose, we have to be careful not to disrupt the natural function of the nose, because remember, the nose is important for breathing, and it's also important for filtering the air that we breathe in. And so if we start to narrow it too much, we can sometimes disrupt the natural function of the nose. So that's always a risk of a cosmetic rhinoplasty, because usually cosmetic rhinoplasties make noses smaller rather than larger, and functional rhinoplasties tend to do the exact opposite. They make the nose a bit bigger to restore some of the function. So it's always about keeping the nose as aesthetically pleasant as it can be, but also functioning properly. I also observed here that Lindsay may have started to reduce the amount of lip filler that she was getting, because to me the lips actually look a bit smaller now than they did in prior years, and they're looking a bit more natural because you have less of that anterior projection of the upper lip and less settling into the cutaneous portion of the lip. Lindsay recently told Allure that her secret is that she just takes care of her skin. I don't know what she uses for her skincare. Maybe it's our Feel Confident line of skincare products, maybe it's something else. But what I do know is that skincare alone is unlikely to explain her recent transformation. Let's take a closer look. So here she is in 2024 at 38 years old. And I looked at a bunch of recent photos and some of her video appearances recently, as well as a lot of her older photos. And I am seeing some signs of a potential endoscopic facelift. Now, I don't see the usual signs of the standard facelift around the ear type of incision approach, where we sometimes see sideburn hair that goes missing, or we see the tragus looking flattened like a pancake and stretched out. I don't see those types of changes for Lindsay. So it's possible that through an endoscopic approach, she had an incision behind the hairline and was able to achieve some of these changes. But what I'm noticing is that there's less submental fullness. There's also less of a pronounced nasolabial fold that she had previously, and the jawline just looks tighter. It looks tighter than it did in previous years. And who knows, maybe this was just non-surgical type of lifting through something like a radiofrequency energy, where there's microneedling and radiofrequency that tightens some of that skin and can give some slight lifting potential. But I think that is less likely than a surgical type of lift that's more consistent and more impressive in the amount of lift that it creates. I also think that maybe Lindsay had a fat transfer to go along with the endoscopic facelift. And this fat may have been distributed to areas like her lips, her lower lid to cheek transition, and also to the cheeks more broadly, such as the medial and the lateral cheek, and maybe also to the temples because they look a bit more filled in as well. And keep in mind that one of the benefits of a fat transfer isn't just the volume that you get from the fat cells, but also the stem cells that exist within the fat. Those stem cells can greatly improve the quality of our skin. So while our moisturizer has plenty of peptides in it, but it's usually not as impactful in rejuvenating our skin compared to a fat transfer that's bringing a lot of our natural stem cells into a new area. And the total cost of these potential procedures is $275,000. From her early days on the Disney Channel to her current status as a pop sensation, Sabrina Carpenter has captivated us with her incredible talent and stunning looks. But many wonder, has she undergone cosmetic procedures to enhance her appearance? All estimated costs and a before and after are revealed later on, so stay tuned. In her teenage years, what we see here are high, full brows. She has nice infrabrow fullness and supratarsal show. When I look at her nose, I see a narrow nasal bridge. And her upper to lower lip ratio is about a 0.9 to 1. She does have upper tooth show on repose, meaning when she just parts her lips. And she has a strong upper and lower jaw, including a strong gonial angle, and that's the angle of the jaw right in here. What that does is that it increases the width of her lower face, and that can be caused by the actual thickness of the jaw itself, or sometimes by the muscle that overlies it called the masseter muscle. You may have heard that some people get Botox injections into that muscle to try to reduce its strength, whether that's for helping them with TMJ pain or potentially to reduce the width of the lower face. But that muscle or its underlying bone can add to the lower facial width. In 2017, at the age of 18, Sabrina has nice youthful cheek fullness, and that fullness is more medially based, meaning closer to the center of her face. And that really works in youth, but as we get older, some people try to recreate that with filler, and it can look somewhat artificial, especially as the face starts to sag and medialize and move down. That extra weight in the medial face with filler can at times look a bit unnatural, but in a youthful state, it is very natural appearing. And I wanted to point out here that the nasolabial folds are very much present, and this is how it actually looks in a more natural state. So when people try to again use filler to efface the nasolabial folds, things can start to look a bit more artificial because you're starting to blur those boundaries, those facial subunits between, for example, the perioral area and the cheek complex. In a natural state, those boundaries are more well defined with things like the nasolabial fold that serves as the boundary between those subunits. And I also wanted to point out here what I think is a distinctive characteristic of Sabrina's face, which is that the philtral columns are not well defined. So in some people, you have quite a bit of depth to the central area of the upper lip where the philtrum lives.
and you have the philtral columns on either side. In Sabrina's case, the area of the upper lip is flatter and there's less of that indentation between the philtral columns. And that gives her quite a distinctive look. In 2018, at the age of 19, when I look at Sabrina's profile view, what I'm seeing here is that she has a more rounded type of forehead, and that can sometimes give the illusion of a larger forehead. But it's not that she has a large forehead. It's not that her upper third is much larger than the middle third or the lower third, but what gives it that illusion is how much roundedness there is to the forehead itself. And that might be one reason why she seems to use her hair to hide partially some of her forehead. Now, it might have nothing to do with that, or the roundedness might have something to do with her actual hairstyles. Keep in mind that the size of the forehead is not just its height centrally, but also the width of it laterally. So how far out it goes to the sides will also dictate if it looks like a larger forehead or not. Some people have quite a short forehead centrally, but as you go out laterally, there's quite a bit of width, let's say from the tail of the brow to the actual temporal hairline. And so sometimes when I'm doing hairline work and looking to help frame the face, it's not just bringing down the central hairline, but it's also bringing in the lateral hairline, because that can also shrink down the overall appearance of the forehead for people who are bothered by that. Also on profile view, what I'm seeing here is a small dorsal hump. So as you come down from the radix of the nose down towards the tip, you can see that there's this slight convexity to the nasal bridge, and that's that small little hump. In 2019, at the age of 20, Sabrina seems to be using makeup to highlight certain aspects of her face. For example, when you look at her cheekbones, there's a bit more definition there, and I think part of that is because of the shadowing that's placed underneath the actual cheekbone, and that gives the cheekbone a bit more of a pop. Also, I do think that she's starting to overline her upper lip, and that's starting to create more of a one-to-one upper to lower lip ratio. But I also see some signs here of the potential introduction of lip filler, both to the upper lip and to the lower lip, to add some hydration and a bit more volume. As we know, with lip filler, it's important not to overdo it. You don't want the lip to start to stick out anteriorly to project forward, because that's what gives that ducky appearance. So avoiding the actual vermilion border when you inject is very important in trying to prevent that type of appearance. And I think that they've done a very nice job in Sabrina's case of not overfilling the actual vermilion border. In 2020, at the age of 21, I see no change. In 2021, at the age of 22, what really stands out to me here is how thick Sabrina's eyebrows are. It's quite in vogue again to have thicker eyebrows, and there are different ways in which people can achieve that look. Now, for some people, it comes down to just using more makeup. Other people might try some tattooing or some more permanent type of makeup, or even microblading. Yet others will sometimes go for eyebrow hair extensions that get glued on. And there's another method called an eyebrow hair transplant, which isn't as common, but it's something that I do in my practice, and we have dedicated videos on that subject, and that can really help enhance, especially after someone's done a lot of plucking or their eyebrows are just naturally thin. But I think in Sabrina's case, her eyebrows are naturally quite full, and she's sporting them, which I think they look great. Also, what I think we're seeing here is potentially the introduction of cheek filler. When I compare back to this image of her in 2017, what I'm seeing is that now there appears to be more laterally based volume in her cheeks, as opposed to her more original organic state, which is more medially based volume. So now there's this extension out laterally, which starts to bring more of that width to her upper face as opposed to just the lower face. Some people will actually get cheek implants to achieve a similar appearance, but I think in her case it was probably cheek filler that was added to the zygoma region of her cheek to fill out that lateral component.
And before I continue, I just wanted to thank everyone who's tried our Feel Confident skincare and hair care products. We made them from scratch with love. We put amazing ingredients in them, and we tried to keep them affordable. So thank you guys for showing your support, and for some of you for even becoming brand ambassadors, which is really cool. And for anyone who hasn't tried the products yet, make sure to head to feelconfident.com to try them for yourself. In 2022, at the age of 23, I see no change. In 2023, at the age of 24, I'm seeing some signs of a potential tip rhinoplasty. So to me, Sabrina's bridge looks untouched. It has the same width as it did when she was in her teenage years. But now the tip appears to be more narrow. It's similar to the width of her bridge, whereas before the tip was wider. And these results are less obvious than when the hump is also taken down. So many celebrities will actually leave some convexity to their nasal bridge with that hump and instead just get their tip more refined. That's harder to spot than when the whole nose is redone. And when we compare back to Sabrina at age 16, we really start to see that difference to the nasal tip, whereas the nasal bridge looks quite similar. And in 2024, at the age of 25, when I look at Sabrina's lips, to me, the upper lip looks more arched. And I think that's probably from the continued use of filler. I don't think she's had a lip lift. So with the overlining and the additional filler, that's given her upper lip quite a nice upper arch. And that's something that is sometimes difficult to achieve naturally with filler, but I think her lips still look great. So this was likely done with small, tasteful amounts of filler over years to create this appearance. This is not something that you just go in, get 1 syringe of filler or 2 syringes of filler at one time and call it a day. This is something that's done gradually with a very calculated approach, and I think that she still looks youthful and natural and does not look like she has overdone lips. And the total cost of these potential cosmetic procedures is $40,000.
Ryan Gosling has been at the forefront of male beauty standards for 3 decades. Has plastic surgery played a role in his appearance over the years? Let's follow his evolution. In 2001, at the age of 21, what I'm seeing is that the right frontotemporal corner is slightly more recessed than the left side, and this is the case in 90% of people. But if you look at natural patterns of the direction of hair growth, as you get closer to the right corner, usually the hair on the right side of the hairline tends to fall over to that corner, essentially allowing you to cover it up. And that's the pattern that I see with most of my hair transplant patients. Ryan also has some curvature to his forehead, and what that can sometimes do is give you the illusion of a higher hairline than you actually have. In 2002, at the age of 22, Ryan has a small dorsal hump on his nose. He also has about a 90-degree nasolabial angle. Contrast that with Margot Robbie's nasolabial angle, and you'll see the difference between a more ideal male aesthetic compared to a more ideal female aesthetic. Ryan Gosling has a flatter upper lip structure, and he has a strong lower jaw. In 2003, at the age of 23, Ryan has great eyebrow fullness. He has upper eyelid hooding with a possible congenital ptosis on the left eye compared to the right. Ryan also has lower eyelid hollowing, and he has that prominent orbicularis oculi muscle at the lower eyelid. What I'm seeing are actually signs of a potential rhinoplasty, and it may have been coupled with a septoplasty at the same time. His nose appears straighter and more narrow from the frontal view. It's pretty common to combine a septoplasty with a rhinoplasty. A septoplasty is when the central partition of the nose is modified to essentially create a straighter path for air to flow. So when people can't breathe well from the left side of their nose or the right side of their nose, a septoplasty can sometimes help in the right candidate. Now, a septoplasty can be combined with a rhinoplasty to change various elements of the external structure of the nose as well. This can be for functional reasons such as improved breathing, but it can also be for cosmetic reasons, such as making the bridge of the nose more narrow or defining the tip of the nose. Once again, when I look at Ryan's nose from 2002 into 2003, the main changes are that the bridge of the nose just appears more defined, and the tip of the nose as well. There's less bulbosity to the tip of the nose. His nose, to me, appears more midline, and it appears straighter and more defined than prior. In 2004, at the age of 24, what I'm seeing here is that Ryan does have a prominent left ear. It tends to stick out a bit more than his right side. The left ala of his nose is larger than the right. And some people end up getting alarplasty procedures to try to adjust the nostrils and to make the alas more symmetrical. And what I'm noticing in this photo here is that there's some missing beard hair on the left medial cheek. And this is something that you'll see in years to come as well. There is some missing hair as well on the right medial beard, but on the left, there's less density. In 2006, at the age of 26, there's more facial fullness. And this is particularly true in the medial cheeks. And this could potentially just be a result of some weight changes that have occurred. You can also see that Ryan has a very prominent and strong brow ridge. This is quite a masculine feature. And when you look at his nose from the profile view, you can see that there's columellar show. It's a good exercise to try to differentiate columellar show from alar retraction. Both can give the appearance of a heaviness down at the bottom of the nose, but alar retraction is when you actually have a lifted ala here. The rim of the ala is actually lifted, and so it looks like you have more nostril show. It's not so much that your columella is hanging low. Alternatively, like in Ryan's case, the ala is in a very natural position, and you can see that there's some prominence to the base of the columella here, or the base of his septum. In 2007, at the age of 27, I'm noticing that the forehead and the glabellar rhytids are more pronounced. And in 2010, at the age of 30, I'm seeing some signs of a potential brow lift. Now, when you look at the shape of his eyebrows, the medial portion, or the portion closer to the center of his face, is more lifted now compared to the year prior. His eyes now appear more open. But you can notice that the upper eyelid ptosis, specifically on the left side, still remains. People get brow lift procedures generally to look less tired and to rejuvenate the eye area or the periorbital area. And in men, you have to be very careful when doing brow lifts because you don't want to feminize the face. And that can be a tricky balance because you want to lift the brows so that there's less heaviness on the eyes, but at the same time, you don't want to create too much arching of the brows either. And in 2011, at the age of 31, what I'm seeing is that there are really no signs of increased forehead height despite the brow lift, because most brow lifts will actually increase the forehead height as the hairline gets pulled back. And this is true even with endoscopic approaches to brow lifts, which are some of the more modern approaches, but they still have the potential to elevate your hairline or to increase the forehead height. And I'm not seeing that in Ryan's case, which is great. And his hair, as he enters into his 30s, is still looking fantastic. To keep your hair looking as optimal as possible, make sure to check out feelconfident.com. In 2012, at the age of 32, I see no change, and that's the same through 2016. In 2017, at the age of 37, I'm seeing some signs of potential lower eyelid filler. He had previously addressed the upper eye area, and now the lower eye appears less tired as well. And now that the lower eye area has also been addressed, he appears even less tired and more alert. In 2018, at the age of 38, what you can see is that Ryan has a more pronounced upper nasal rhytid. This horizontal crease that runs along the upper part of his nose is caused by the procerus muscle. This is a muscle that lives right here at the top of the nose, right at the bridge,
and it runs vertically. And that's what we see with all lines and deep wrinkles of the face, is that they're running perpendicular to the belly of the muscle. In 2019, at the age of 39, I'm seeing the potential introduction of cheek filler, especially into the medial section. So oftentimes when we age, the cheek falls down and into the middle of the face. And that's the general trajectory that it has. So it can sometimes be more obvious when people get filler placed into their cheeks that's being done more into the central part as opposed to out here into the lateral part of their face. In 2022, at the age of 42, what I'm starting to see is that now 12 years later, after his brow lift, the brows are again starting to sag. And now they look close to their pre-brow lift position. And that's what we see with most types of lifts. Even if it's done really well, after about 10 years plus, there is a sag that occurs inevitably as we all age. So whether it's a facelift, a brow lift, a lip lift, most types of lifts will start to fail eventually. And some people go back to get that procedure repeated to bring them to a more rejuvenated, lifted state. Nothing lasts forever. And in 2023, at the age of 42, I also see no change. And the total cost of these potential procedures is $75,000. People online have speculated that Chris Brown may have had a hair transplant, a brow lift, a rhinoplasty, or even a lip reduction. Are there signs of any of these claims from his photos from over the years? Let's take a look and decide for ourselves. In 2007, at the age of 18, you can see that Chris has a nice shape up with his hairstyle. He has strong temporal points, and these are sometimes what I have to create surgically, but he has them naturally. He has horizontally based brows. He has some upper eyelid dermatochalasis, which is just some excess tissue in that upper eyelid region. He has a wide nasal base with some alar flaring, and he has full lips with upper tooth show on repose when he parts his mouth. Chris also has a strong jawline. And in 2008, at the age of 19, what we see here is a strong frontal brow ridge, which is quite masculine. And he also has full tooth show when he smiles. His upper to lower lip ratio is about a 1:1. In 2009, at the age of 20, when I look at the right side of Chris's hairline, he has this whorl pattern, and that's what gives it some of that irregularity. Now, some patients have a whorl pattern only on their crown, whereas other patients might have whorl patterns along their hairline. I've seen it just in the central part of the hairline. I've also seen it out laterally. So to my eye, Chris seems to have one that's more right-sided along his hairline. Chris also, in these photos, has some slight frontotemporal recession. It's very minimal, but you can see it starting to happen, even though he's only 20 years old. I do have some patients that are in their late teenage years that are nearly Norwood 6 and 7. They've lost a significant amount of hair, even though they're quite young. So sometimes with male pattern loss, it can present quite early and it can be quite advanced. So I was looking at these photos and wondering, could these be some signs of a brow lift here or maybe even a blepharoplasty? Honestly, it's unclear. There are no clear signs of scars. I'm not sure if at age 20 he would have taken the risk with such short hair to get a brow lift, because clearly they didn't do a direct brow lift because we don't see a scar along the brow. They wouldn't have done a, mid forehead type of incision because, he's 20 and this would have been in the middle of his forehead and his wrinkles aren't yet fully set in where, you wouldn't use that as a potential spot for an incision. An incision by the hairline or just behind the hairline would have been quite obvious to detect with his hairstyle. So I just don't see it, even though the brow to me looks slightly elevated more than before, and there's now reduced impact on the supratarsal area. I still have doubts on whether or not he actually had a brow lift or a blepharoplasty. And in 2010, at the age of 21, I see no change. In 2011, at the age of 22, Chris has started to dye his hair. And you have to make sure when you're dyeing your hair to just practice just safe kind of basic precautions for hair dyeing. And that includes reducing exposure to harsh ingredients. ingredients like ammonia and hydrogen peroxide. With frequent dyeing of one's hair, you run the risk of developing some brittle hair and also irritation to your scalp. So try to reduce the harsh ingredients and try to reduce the frequency at which you dye your hair, if that's something that you do. In 2012, at the age of 23, I see no change. And in 2013, I also see no change. In 2014, at the age of 25, when I look at Chris's nose, I saw some speculation on whether or not he had his nose narrowed and built up along the bridge. To me, it looks very similar to his original nose. So I would say that I see no signs of a rhinoplasty. In 2015, at the age of 26, when I look at his lip volume, again, compared to 8 years prior, it looks unchanged. I don't think that, at least at this point, that he's had a lip reduction. A lip reduction is a procedure that can reduce the red portion of the lip, either on the upper lip or the lower lip. Sometimes it's used for a global reduction when people just feel that their lips are too full and they're trying to get the upper lip or the lower lip to look just thinner. It can also be done for a localized type of procedure where you're trying to address either a scar or some specific tissue prominence, and so you can just reduce that one area to make the lip look more even overall. You can do it globally, or you can do it locally in one specific spot. And I think one of the reasons why people are guessing that maybe Chris Brown had a lip reduction is because they're looking at his lips, but from different distances from the camera. So as we get closer to a camera, our facial features look bigger. And that's why in selfies, most of us have like a bigger nose or bigger lips. As we move away from the camera, the facial features start to look more like their normal size. And so when assessing someone's face and trying to figure out how they had these procedures, it's important to keep in mind facial proportions and not just to jump to conclusions about, let's say, the lips by just looking at only the lips and not in relation to other facial features. So in my estimation, I don't see any signs of a lip reduction in Chris's case because I've looked at those different distances from the camera and how they relate to his other facial features. And when it comes to his hair, the frontotemporal hair loss has slightly increased. You can see a more recessed corner on both sides compared to prior. In 2016, at the age of 27, Chris has started to adopt some of these tighter hairstyles. And remember that a tighter hairstyle can lead to traction alopecia. Because of that pulling on the root of the hair or the hair follicle, you start to build up inflammation. And if you continue to have that tight style, you can start to lose some of those hairs. And it can be permanent if it's not reversed quickly enough. So in addition to some of the risks for your hair associated with hair coloring, make sure to also be careful with how tight you wear your hair. And in 2017, at the age of 28, I see no change, and that's the same through 2021. In 2022, at the age of 33, now that Chris Brown is in his 30s, his cheekbones have become more prominent. And that has to do with, in part, weight loss, most likely, but also as we age, the quantity of fat in our face diminishes. And that's one of the reasons why I speak up against buccal fat removal when people are much younger, because later on they'll be wishing that they had that fat back. But in Chris's case, I don't think he's had any buccal fat removal, but I do see this cheekbone prominence as some of the other fat in the face has started to thin out. When I look at Chris's nasal base and his tip, they look similar to me compared to the original. I really don't see any obvious signs of plastic surgery or say something like a nasal filler. To me, it looks quite similar to the original. Also, in looking at his lips, specifically the amount of tooth show that's there, I again think that it's unchanged. And a lip reduction has the tendency of exposing more of your teeth. So because we see about the same amount of tooth show on the upper teeth and the bottom teeth, I don't think that he's had a lip reduction on either the upper lip or the lower lip. In 2023, at the age of 34, tattoos on the face are not exactly like tattoos anywhere else on the body. The facial skin tends to be thinner than other areas of body skin. And when you have thinner skin, when you go in with the needle to do the tattooing, if you go too deep, which is more likely with thinner skin, you can start to get these bleeding lines and a blown out type of result. Also, our face is more exposed to the sun. So with that constant sun exposure comes different changes to our facial skin, and that can of course also affect the appearance of a facial tattoo. And when we wash our face daily, such as with the Feel Confident facial cleanser, what happens is that the tattoos on our face can start to fade quicker. And when someone is dissatisfied with their tattoo, they'll sometimes either get a different design over the original, or they might want it laser removed. But it is difficult to laser remove a tattoo completely. So when it's on your face and you no longer want it there and you go in for that lasering, what you'll find is that there'll still be some semblance of the tattoo. Even though it'll be less obvious, it will still be there. And so that's something else to remember about tattoos on the face. And if someone is interested in getting a facial tattoo, I think it's very important to find a subspecialist tattoo artist who really knows what they're doing with that part of the body. Similarly, when someone is getting like a facial plastics procedure, it's important to go to someone who does this stuff all the time. And the more specialized they are, I think the higher your chance of success for that procedure. And this year, in 2024, there's been some speculation about a potential hair transplant towards like the end of last year. When I look through all of these photos, first of all, he's wearing lots of hats lately. So at first I was like, well, maybe there is something there. But he did not have his hat on for the podcast in November of 23 with Funny Marco. And to me, his hair looks pretty much unchanged. And when I look through even some of the highly edited types of images, I think maybe they use some makeup to sharpen some of the lines, but I don't see clear evidence of a hair transplant for Chris. And so to me, I think Chris's hair has been fairly stable since about 2015. And the question is, with the recession that he was developing in the years prior to 2015, how is he able to stabilize the hair and not continue to recede? It's possible that that was just his pattern, that he was always destined to have that pattern and it wasn't going to get worse on its own. But it's also possible that he actually started medication to help stabilize that hair. And the main medication that does that is finasteride. Finasteride is most commonly prescribed as a pill, something that you take daily, but it can also be prescribed as a topical formulation. That is off-label use, but something that is done and is still effective with reduced side effects. So if you're looking to potentially get on finasteride to try to prevent your own hair loss, make sure to check out feelconfident.com, where you can get the medication affordably delivered right to your door. So the brow lift and/or a blepharoplasty is the only potential procedure that I see some signs of. But again, I have my doubts given his age at the time that I started to see those changes and the type of scarring that would have led to. And I don't see the signs of scarring. So even though I do appreciate some change in his brow position, I'm not convinced that he actually had surgery. I see no signs of a lip reduction, a rhinoplasty, or even a hair transplant.
I'm a double board certified facial plastic surgeon, and today I'll be shedding light on Millie Bobby Brown's facial transformation over the past few years. But before I do my analysis, let me first react to Millie's recent Instagram post.
I grew up in front of the world, and for some reason, people can't seem to grow up with me. Instead, they act like I'm supposed to stay frozen in time, like I should still look the way I did on Stranger Things Season 1. And because I don't, I'm now a target. One article reads, "Why are Gen Zers like Millie Bobby Brown aging so badly? What has Millie Bobby Brown done to her face? Millie Bobby Brown mistaken for someone's mum as she guides younger sister Ava through LA. This isn't journalism. This is bullying."
Specifically, I have 3 main points to make. In her video post, she brings up a few journalists and some of the articles that they posted about her appearance. And the summary of these articles is as follows: that Gen Z is exposed to a constant stream of filtered and edited images, creating unrealistic beauty standards. Cosmetic treatments like filler are creating a more aged appearance, with people looking more alike. And even excessive skincare can cause irritation and damage to our skin, also leading to more aged appearances. And that is by the way, when I talk about skincare, I promote a more pared down approach to skincare, specifically focusing on products that are hypoallergenic and that promote the hydration of our skin without causing irritation. And one of our best-selling Feel Confident products does just that. That's the HA serum that we have. Make sure to check that one out. Point number 2 has to do with what Millie said in the past about growing up as a child star. You cannot speak on children that are underage, she said. I mean, our brains physically have not grown yet. To diminish and practically stunt someone's growth mentally, strip them down, tell them, hey, listen, you don't look that great. Why are you wearing that? How dare you think you can wear that? How dare you say that? But I think that any parent allowing their child to be a child star needs to carefully consider the ramifications of that decision. Once people are out in the public eye, people will of course talk, especially now with so many social media platforms available. I agree with protecting our youth's mental health, but that I believe is best done by keeping our youth out of the public eye in the first place. Point number 3 relates to anyone being a celebrity. That comes with people commenting and speculating about their every move. And that often includes their appearance. But it's not necessarily from a place of evil or someone being ill-spirited. Often it's based on people's intrigue and curiosity with that celebrity. Or to explain a recent trend that has the potential to influence millions of other people. Celebrities yield massive influence, and with that comes enormous responsibilities. Their appearances and how they achieved it can discourage or promote certain styles or procedures, even if they don't admit to having had anything done. On one hand, we should respect a celebrity's privacy to not disclose an aesthetic procedure. But on the other hand, if they did disclose it, it would allow other people to see how they could potentially achieve a similar look, or what they might want to avoid. Where the public lacks information, they will fill it in, sometimes incorrectly. Well, here's my attempt at educating the masses about Millie's beautiful face. In 2020, at the age of 16, you can see that Millie has very proportional horizontal thirds of her face. She has full eyebrows, supratarsal show, and infrabrow fullness. She has some slight nasal tip bulbosity, which we know is normal. And she has strong upper and lower jaw structure. Her lips appear full, she has a short philtrum, and she has upper tooth show when she parts her lips and smiles. In 2023, at the age of 19, Millie has an M-shaped hairline. This is a common, normal variant of a female hairline. Sometimes we see a more rounded appearance, and other times we see a more M-shaped appearance. Millie has normal-looking nasolabial folds. Remember that we all have nasolabial folds. She also has full upper tooth show on smile, and this is a favorable aesthetic trait. In 2024, at the age of 20, I see some signs of potential lip filler, and as we compare to 2019, we can see some slight lumpiness to the red lip. We also see that some of the material may be settling just outside of the vermilion border. Even in the best of hands, when it comes to lip filler, it's very easy for the material to migrate and to go to places where it wasn't exactly intended to be. And sometimes that happens at the time of the injections, and other times it just happens over the course of months to years after the filler was initially placed. There are, of course, certain techniques that might increase the potential for that filler settling outside of the red lip. And one technique that does just that is the Russian lip filler technique. As those injections are placed almost vertically and going through the vermilion border, some of the filler will settle out outside of that border. In 2025, at the age of 21, we can see that Millie is now experimenting with a new hair color, which looks great. Her lips continue to look different from, say, the SAG Awards from 2018. When we compare to this year's SAG Awards in 2025, we can see different proportions of her upper lip to her lower lip. In 2018, the lower lip was larger than the upper lip, but now in 2025, we can see that that ratio is essentially reversed, with the upper lip appearing slightly bigger than the bottom lip with the same 3/4 type of view. Her current lip proportions speak to the change in the ideal aesthetic over the last 7 to 10 years, which is that the upper lip to lower lip ratio being closer to a 1-to-1, or with the upper lip being slightly larger than the bottom lip, is now broadly accepted. With classic beauty standards, we usually would see that the bottom lip was larger than the upper lip, but now there's more of an acceptance for an even balance between the two, or the upper being slightly larger. I'm also seeing the potential introduction of cheek filler. As I look at Millie's medial cheek and lateral cheek, to my eye, they appear more prominent than they did in prior years. Now, could that be just the result of her getting older, or maybe some weight fluctuation? Of course that's possible, but it could also be the introduction of filler in that area. And there are a few options when it comes to cheek augmentation or enhancement. The most common way to enhance the cheeks these days is with HA filler or hyaluronic acid filler. You may have heard of Restylane or Juvederm. Those are types of HA filler that can be injected into the cheeks. When it comes to filling the cheeks with HA filler, usually a higher G' filler is selected because typically it's placed down onto bone. So you want a thicker substance that will closer mimic the bony type of structure. That's very different from injecting the lips, for example, because in the lips you want a low G' or a thinner type of consistency to the filler, because this is a more delicate area. And you don't want that thick filler that will look heavy and out of place in the lips. Another option for cheek augmentation is fat transfer. That's when fat is taken from areas like the belly or the thighs and first processed, then transferred to the face. The process of injecting the fat is actually similar to injecting HA filler. It's just a different type of filler that's your body's own tissue and usually lasts much longer than hyaluronic acid. Remember, with fat transfer, usually only about half of what's transferred survives. The rest of the fat essentially gets resorbed by the body. So typically you need to overcompensate with the filler that's being placed because you know half of it will go away. The tricky thing about fat transfer is that there's nothing you can use to dissolve it away. It's not like hyaluronic acid that has Hylenex that can be used to dissolve away the HA filler. With a fat transfer, you're essentially stuck with what you got unless you go and surgically remove fat deposits that you're not happy with after they've settled. Another type of filler that can be used to improve the cheek structure is Sculptra. This is a biodegradable and biocompatible substance that actually promotes collagen production. And we filmed a video with my PA about this very topic. If you want to learn more, make sure to check out that video. Another option to augment the cheeks is using threads. Threads are essentially made of dissolvable suture material, and they typically have these barbs on them that can pull and reposition the skin, and they're placed out laterally and they go down into the tissues and they can pull the cheek complex up. The problem is that the effects of the threads usually don't last very long, so people might be happy for a few weeks, maybe a few months, but then you have to continue to repeat that process, and like filler, they can cause problems like infection. With threads, you can also get some dimpling under the skin that can be quite annoying until the suture dissolves. But up until now, the discussion has been more about minimally invasive ways to augment the cheeks, but there are also more invasive surgical methods to augment cheeks. One approach for surgical augmentation of the cheeks is with a cheek implant. These are usually made of silicone, similar to breast implants, but they have very particular shapes that allow them to sit right in this region directly on the bone, and in so doing, they're giving additional shape and contour to the cheeks. And sometimes they can even make the lower eyelid to cheek transition more smooth, reducing the appearance of that hollowing at the lower eyelid. These implants are surgically placed directly on the bone through incisions made inside the mouth. Nowadays, it's possible to get a CAT scan and to get 3D printed implants that are properly planned to your bony anatomy,
before surgery. So when your surgeon goes in to place the implant, there's already a plan in mind and there's a more perfect fit of implant to your cheek compared to basically having to sculpt an off-the-shelf product. These more custom-fitted implants are basically the state of the art when it comes to cheek implants. One of the main issues with cheek implants is that as our faces mature and change with time, sometimes you need to change out those implants because it no longer makes sense with the modified anatomy that you get from the aging process. And then of course, there's the surgical facelift. Facelifts have the potential to take the cheek complex that has descended and usually medialized and to redrape and place it back to where the fat came from, which is usually on that upper lateral cheek. So there have been studies on this, and it's been found that facelifts usually bring in at least 2 cc's on average to that cheek complex. So even without additional HA filler or fat, just having the facelift alone can restore the cheek area. And there has been a trend towards younger and younger patients getting facelift surgery. And I've definitely raised concerns about this trend. My biggest fear is that as younger and younger people get more invasive cosmetic plastic surgery on their face, they're going to continue to want to get more and more surgeries. So by the time they're older, they will have had so many more procedures that now there's more scarring. Now there's more potential for risk, like nerve injury, like bleeding risk. And that risk will compound over time. So in general, I think it's better to start these cosmetic surgeries, if you're going to start them at all, later in life and not rush to do them too soon. Also, younger patients need time to mature for their ideas to come together for how they feel about themselves. And a lot of times I find that if you just wait and give them time to figure out how they feel about themselves, about their appearance, about how other people view them, usually some of those early desires will start to fade away. And they'll sometimes realize that, hey, I actually don't need that at all. And so I think rushing into doing facelift surgery on very young patients is problematic. And then of course there are some patients who get a combination of these different treatments. They might get a cheek implant and a lift, or they might get a lift with some fat transfer, or they get some HA filler and then later on they come back for some Sculptra, for example. But all of this to say that there are options when it comes to cheek augmentation if that's what someone is looking for. On this channel, I dissect faces not to bully and criticize, but rather to educate the masses on what is achievable with today's procedures and technologies. I think that everyone deserves to have the information and access to the same things available to celebrities. Speculating on whether or not a procedure happened or if aging effects happened is very different from passing judgment on how good or bad it looks. But I understand that not everyone commenting on the looks of celebrities has these same intentions in mind. And sometimes it can be ill-spirited and it can be mean, and I understand that that can hurt that celebrity's feelings. Listen, I get comments all the time on my channel about my lack of eyebrow hair, or how pale my skin looks, or that I look tired. I hear all that, I see all that, so I understand that when you amplify it by, millions more being interested in, let's say, Millie's personal journey, that can be very difficult to withstand, and we need to be respectful of that. But I want people to know how our faces are structured, how they change over time, and what options people have to look and feel their best. And if spreading that knowledge means covering some celebrities and discussing what may have happened, I will continue to do just that. But let's also continue to support Millie in her personal aesthetic journey, whether she does or does not do any procedures. But at the same time, her actions do not exist in a vacuum. And many young women, including eventually my daughter, are subject to influence by her and others like her. These are important dialogues that I think we should continue to have. Millie, if you ever want to sit down for a podcast-style chat to discuss more with me about this topic, please let me know. You can have your team email us. And if you've enjoyed this video, please make sure to check out my reaction to Ariana Grande calling me out.